Well, unlike most of the speakers today, my background is not in ethics or legal research, so I'm trying to give you the perspective of a machine learning researcher in a very specific application. And so I think using machine learning in brain research, first of all, it raises, of course, methodological questions, but also raises specific ethical issues. And to introduce this, I split my talk into two halves. In the first half, I will introduce the domain of using machine learning in brain research. So if that's not interesting to you, it's safe to take a nap of 7 minutes now. In the second half, I will just raise a number of ethical questions that I think are very relevant. Just bear in mind that this is kind of my layman, somewhat naive view on this topic, but I hope that it's useful anyway. So as just announced, I will start with introducing the field and the kind of research that we're doing. And when I'm talking about brain research, we are working with signals, and this picture just demonstrates a number of ways to obtain signals from the brain and the electrophysiological activity of the brain. And I'll be mostly talking about, this is working. Oops, sorry. EEG, which is essentially electrodes that are placed on the scalp, and they measure the electrical currents emanating from the brain. And there's other methods called electrocardiography, where electrode grid is put inside the brain, on the brain surface, or we have even electrode grids implanted into the brain. And I think you see right away on this plot already that there's serious ethical questions that are concerned with the way we measure brain activity. And one specific application where machine learning is very important is so-called BCIs, which stand for brain-computer interfaces. And the motivation here is clinical populations, such as patients suffering from tetraplegia or amyotrophic lateral sclerosis. And they often they have a loss of motor control, and in extreme cases they are not able to communicate with their environment, but they might still be cognitively intact. So the idea of a BCI, which is really a combination of machine learning and real-time neuroimaging, is to directly measure the brain activity. And for this we use some sensors. This could be EEG sensors, like in this picture. And then the signal is fed into some machine learning algorithm. And the idea of the task of the algorithm is to predict the mental state of the user. For example, does the user want to communicate a particular message? Does it want to move, like say, prosthetic arm in a particular direction? And the output of this algorithm is then fed into a machine, which could be a computer screen where you type a message, or it could be operating a wheelchair, or even interacting with a robot, potentially. In the next 2 slides, I just want to briefly discuss 2 very specific studies that I've been working on, and please just take it as a kind of representative study for the experiments that are in our field. So one is on mental typewriters, which is work that has been done by my master student, Nico Schmidt, when I worked in Berlin. And one application in BCIs is we want to enable patients to communicate with the world again. And a simple approach is just to present letters on the screen, such as in a temporal fashion, such as F, A, C. And then we have an algorithm trained to look at the brain response following each letter. And we want to guess with the algorithm what kind of letter the subject wants to type. And in this specific experiment, we were actually interested in what happens when the user is presented the feedback. So at some point, the machine learning algorithm takes a decision, like I think the user wants to write a C. And of course, this could be a correct decision, but since our algorithms are imperfect, sometimes we make an error here. And in this specific study, we are actually interested in can we look at the brain response of the user when the user sees the feedback of the BCI? So can we appreciate that maybe the user is unhappy with the feedback or thinks that it's the wrong one? So what we did is we looked at the brain response of a subject following correct output or erroneous output, and this is just the activity on a specific electrode. And I will not go into much details. Basically, the bottom line is, if you're familiar with AOC scores, this tells you the kind of classification performance we get for different participants. And the bottom line is that we were able to kind of reliably decode the subject's performance here. So this is just a very, very in-depth example of BCI experiment. There's another application of machine learning that's kind of growing very much now, which is using it in cognitive neuroscience to actually gain information about the brain. So in the previous application, we really use machine learning for prediction. We just want to predict the intended action of the user. And in cognitive neuroscience, we're interested in using machine learning to gather knowledge about how the brain works. And I'm just, again, quickly walk you through a research I'm working in, and this is, again, just representative for the kind of research that is done in the field. So, for example, in memory research, we are interested in what happens in the brain when people reinstate memories. And in this paradigm, we showed subjects images of, for example, scenes and objects, and they were asked to make up a story, how the scene interacts with the object. And in a later phase of the experiment, we would just show either the scene or the object, and we could actually, the task of the subject was to reinstate the memory of the object that was coupled with the scene. And we were actually able to kind of use a machine learning, use a classifier to find the representation or the upcoming of the memory in the brain again. And this is just to exemplify that we can use machine learning on brain data to even find kind of contents which are very abstract, like reinstatement of memories. And for the sake of time, I'll skip this plot. So let me come to the, for you, more interesting part of the talk. So in neuroscience, there's the umbrella term for ethical research is neuroethics, and most of it is actually not relevant for the workshop today. So I'll basically skip this page. And so what's relevant for today is the ethical questions that are specific to BCI research. And one kind of problem complex is the expectations. So both the expectations of the patient, also the expectations of the caregivers. First of all, the patients often suffer from traumatic brain injury. So we're already faced with a problem that maybe they don't even have the capacities to properly judge the costs or benefits of an intervention. Furthermore, what comes as a kind of disappointment to many subjects is that the motor skills are automatic. I mean, it's pretty easy to move your arm, but it's pretty difficult to move a prosthetic arm using a brain implant or a BCI system. So it requires sustained attention and cognitive effort. And another problem that we're faced is there's a media bias, and it evokes high expectations. And I don't just want to point the finger on the media. It's also something researchers are complicit in. So you might read a headline like "New device reads all your thoughts." Sounds very buzzy. It sounds much more interesting than the title of my papers. But the problem is that you have both patients coming in with very high expectations. They want their functionality being restored because they have this impression from the media that that's what you're going to do, and that's usually not happening. So this can all these things together can of course lead to psychological harm, distress, loss of behavioral control, and furthermore, we are faced with a question whether we should a priori do a selection. So the question is here, do we want an equal opportunity for all possible patients? Do we want to expose them to a BCI system? Or can we select subgroups of patients where we know it probably won't work with this patient? So to prevent the psychological harm to setting up a system that will not work in the end, we a priori perform a selection of patients. So this is a trade-off. And another complex that we're facing is that there's kind of a dichotomy between the clinical practice and the research practice. And so basically the need of the subject is the subject wants a robust system that restores functionality as much as possible. But a lot of the research it's not yet ripe for the market. So there's a lot of tweaking and updating going on. So the interest of the researcher is often to try out new methods or change the parameters and see its effects, which runs adverse to the interests of the patient. And here I think ethics is important, because it's also informing the researchers like me how to set up our experiments in a way that meets the needs of the patients more. One probably good workaround is to try to source out the kind of preliminary stage of setting up a new system, doing a proof of concept study, doing it actually with healthy volunteers. So I've mostly worked with healthy volunteers, and once the system is ripe, try to move it into the clinical practice instead of going to the patients right away and using them as guinea pigs in your very exploratory experiments. And furthermore, if we look at the benefits and risks, there's a trade-off between the level of invasiveness of the system and the signal quality. So if we use EEG, which is the electrodes on the scalp, this is not a dangerous. I mean, it basically has no health risks, but we have a very low signal-to-noise ratio in the signal. As we become more invasive, for example, electrocorticography means that we put an electrogrid on the surface of the brain. We don't penetrate the brain, but it's penetrating the skull, obviously. There's a risk of infection or hemorrhage, and if we use microelectrode arrays, we actually penetrate the brain tissue. So there's additionally the risk of tissue death. However, as you go down this list, the signal quality gets much better. So the restoration of functionality might be much better. So again, this is a trade-off. Furthermore, so there's essentially two patient groups that are relevant here. One is minimally conscious patients that just have some residual awareness, and locked-in patients who are actually conscious, but they lack the capacity for voluntarily body motion. And if they're in a very severe state, they might not have any other way to communicate with the environment other than the BCI. And this brings up a big problem, namely that of informed consent. So if a patient is not able to communicate with the outer world except for using a machine learning algorithm, then actually you as a caregiver, you're kind of talking to a machine learning algorithm. You're not directly talking to the patient. So getting informed consent is problematic here, since we know that machine learning algorithms make mistakes. Also, the caregivers might overestimate the system. So if you set up a system to give a yes or no response, so you maybe ask the subject a question, and the machine learning algorithm outputs, the subject says yes or no. There will always be a yes or no answer, but how confident are you that the answer is correct? And the answer can have very severe implications, of course, if you're asking the patient whether he or she wants to undergo an operation, for example. So this is a huge issue. And furthermore, some issues that might come up in the future. So especially in the US and in Europe, there are clinical trials where we have long-term implants of technology into the brain. This is something that's coming up, and there will be more and more of this in the coming decades. And this, of course, stirs up lots of questions. And one of them is, of course, the privacy of thoughts. So there's a paper that actually just came out this week that shows that we can decode unconscious intentions of subjects in real time. We can actually, by looking at the brain activity, we can do some inference about the psychological traits of a subject. Of course, I mean, a company might be interested in actually probing your brain into what kind of articles you like. And so maybe in the future, Google is not just scanning your emails to give you targeted advertisements, but it's scanning your brain to give you even more targeted advertisements. And another thing is brain fingerprinting. So even if we anonymize brain data, there's some efforts that even just looking at the raw time series, they might have some properties that allow the identification of the identity of the subject. And in a very dystopian future, we might actually be faced with the question of, is there a thought police? So are our thoughts private at all? And actually, this is my last slide, and it sounds a bit pessimistic. So to close a bit more positive, I think that actually the work that you guys are doing and these kinds of workshops are actually essential in preventing for this future to become true. And that's that's it for today. Thank you.
Thank you very much.